All right, good morning and welcome to Your Pet Today.
Good
This,
morning.
as always, Dr. Sarah Hadley. Good morning from All Valley Animal Care Center. And we have a little friend. You're going to meet him in a minute. You've been hearing him for about 10 minutes now. He is a talker.
He is a talker.
Hopper the talker.
Yes.
Almost rhymes. All right, and we're talking about coughing with dogs today. Is coughing normal for dogs?
It's not normal. I was going to say, by the way, this is equally applicable to cats. Most of this is
Okay.
pretty similar information. Coughing can be normal. It's a response to irritation at the most basic level. So if you're camping and the dog gets downwind of the campfire, it's going to cough, and that's all right. You know, he's clearing his system out of those irritants. Of course, it can mean a lot of different. You know, it can mean a problem.
Yeah,
and it can
and
be several different ones.
Okay, and that's our next question. What are some of the causes of coughing?
I would
Hopper?
say the most common is probably some kind of a respiratory problem, you know, like an infection like kennel cough, obviously, or influenza. They can also cough due to a deeper respiratory problem like pneumonia or bronchitis. Also, heart disease is a common cause of coughing, especially in older dogs.
Okay, buddy.
And cats, and then those are probably the two main ones.
Yeah, so you said like influenza, so dogs actually can get sick like people.
Yes, they have their own influenza that has not been shown thus far to pass between dogs and people. The newer strain H3N2 has passed to a few cats.
Oh. And so how much coughing is too much when it's time to head off to the vet?
I would say coughing that interrupts activity, daily activity, or if it's coughing that happens daily, there's not really a normal reason to cough every day.
All right, and what are some of the treatment options?
That depends a whole lot on what we're dealing with. You know, for a kennel cough or something, it could be fairly simple symptomatic treatment. They might need antibiotics for pneumonia. If it's heart disease, then they need medication for the heart problem.
Gotcha. All right, let's talk about Hopper here. He's an interesting looking guy.
Yes, he
Right
is.
Right away, I noticed his markings. He kind of looks like a cattle dog of some
Yes,
sort.
he is part cattle dog.
But you walked in and said he's a mongrel.
Yes, he's a mix. He's got a couple of things going on. He's really cute.
He's a good boy. And look
he's,
yeah, I want to bring this
look
up.
at
His collar, this is like a military issue collar here. And I'd have to speculate that maybe somebody got deployed or something. And
yeah,
you're saying that you do
I'm
run into
not
that.
sure. I know his the owner that gave him up traveled a lot. That's what I know about him.
Oh, traveling a lot. Well, that looks like an official military thing there. So, oh, it's a sad time for Hopper.
look at
He's
his
a really
pretty
good boy.
eyes.
Yeah, he's got two different color eyes. He's very friendly
Yep.
and vocal. So
Yeah.
he's a good boy if you're looking
He
for a
is.
nice dog already
Yeah,
broken in
he's-
and everything.
Yep, he's about 6.
He's about
And
6 years old.
Yeah, he's got a nice temperament.
Yeah, well, if you're interested in Hopper, give the folks at All Valley Animal Care Center a call. The number is 287-3100. And as always, Dr. Hadley, thank you for coming in.
Thank
You're going to
you.
be back next week, of course, and we're going to
Yes.
have a whole nother topic. So be sure to tune in.